To Baton Rouge now, where the legislative session continues. In January, a $2 billion contract between the Office of Group Benefits and CVS Caremark went into effect, despite backlash from many lawmakers, independent pharmacies, and patients. One of those lawmakers is from Central Louisiana and is now looking to take action and make the group benefits program more transparent.
It's to help more patients be in control of their own health care.
Those patients, an estimated 220,000 state workers and retirees with health care coverage through the Office of Group Benefits. With Senate Bill 164, State Senator Heather Cloud wants those patients and their physicians to know what is covered on the front end. Right now, procedures and medications are required to undergo a prior authorization process with third-party companies to determine coverage.
So I believe that there's some incentivization for patients to have their drugs and their procedures denied and reviewed because it becomes sort of a profit center for PBMs.
Denials which cost the state hundreds of dollars as they're appealed. And for patients like Alicia Wheeler, who testified on the bill before the Senate Finance Committee, those denials are causing a headache under the new $2 billion CVS Caremark contract.
We shouldn't put patients in peril when we move from contract to contract.
Wheeler has been on the same medication for years, only to find out that under CVS Caremark, that medication was no longer covered. 3 months of multiple requests for prior authorizations, denials, and appeals, and no one could tell Wheeler why she was denied coverage.
Under the current law, a patient, such as myself, a member, is not allowed to have access to that information. Your physician has to request that information from the PBM.
Senator Cloud's bill would require health plans to develop a list of covered medications and procedures, reducing the number of prior authorizations needed before care can be given. But OGB expressed several concerns over the bill, honing in on the administrative requirement to communicate a review and denial within a set timeline or have to foot the bill.
It's very untenable for us because it actually could lead to cost of the plan, higher premiums for everyone that's involved, inconsistencies in the application of our health care services.
But lawmakers agreed with Senator Cloud that something must be done, passing the bill out of committee and leaving any concerns to be worked out between OGB and the bill's author.